Kerala's youngsters' premature hair loss has become a new normal. And while younger generations are not very overly concerned, they refuse to accept it passively either. To talk more about this issue, we have Dr. Gajanan Jadhao, a very experienced hair transplant surgeon based out of India. Hi, doctor. Pleasure to have you
Hello,
with
hi,
us.
hi.
So,
Thank you very much.
the recent study says that the hair transplants are very common in the state, even in India as well, especially, yeah. But hair transplants among the youngsters between the age of 18 to 25 have become so normal and common these days. What do you think is the reason?
Coming to the problem with the youngsters, when we think about hair transplantation, it is basically done for the baldness. So once we understand that baldness is a problem, then there is no hair root present beneath the skin. So you must be knowing that everybody experiences hair fall, right? But not everybody is bald. So hair fall is a common phenomena with everybody. It's not like that nobody is losing hair or everybody is losing hair. So it's almost everyone loses hair, but it is in a normal condition. Like suppose up to 100 hairs, we can consider as normal up to certain up to a certain population.
Okay.
So when the hair fall becomes excessive and hair do not regenerate, so a normal hair cycle is that it is going from growing phase to a shedding phase. So everybody have the same phases of hair cycle where hair regenerates after falling. When the hair regeneration stops, it doesn't grow back again on the same side. Then baldness occurs. We called it as alopecia. Okay, so yeah, alopecia means doesn't have any hair. It's your skin is completely plain without any hair follicle. So in such a scenario, we need to re-implant hair follicles, which is called as a hair. Okay, so why the people are in younger age losing hair? That is very, very important question what you asked. And we are also in a dilemma nowadays. 18 years guy coming for a hair transplantation is really challenging for us. Like at the age of 18 years, where he has not completed his education, not graduate also, and is looking for a hair transplantation. Nowadays, the scenario is coming there, and this is increasing day by day. So initially, when we have started practicing hair transplantation, used to be a 25 years is the age criteria we have decided. After 25 years, we should plan for a hair transplantation. Nowadays, a guy is coming with 18, 20 years, having almost 50% bald, looking for a hair transplantation, what to do? Like 17 years guy coming, like he's a minor, he's not even major, and he lost his hair, and he has to, he cannot sign even the document also. At the age of 17, he has to take a permission from his father to go for a transplantation. This is the condition happening nowadays. Very sad, very bad actually. When you are young age and you want to be with your friends and you want to go around, roam around, you are like energy at the peak of the world, and you are depressed because of not having time. The peer pressure is there. You cannot go out, you cannot socialize. These are all the problems related to hair fall are coming nowadays. Coming to the point where the puberty, puberty is the age where teenager becomes start adult, like that the age. Like in female, you consider like was the female getting a menstrual cycle, starting of menstrual cycle, we call like the girls are going into the puberty phase. In male, we can have like a mustache and axillary hair, as well as the voice started changing. So this is the age where we usually changes our hormonal level. Like a male started secreting more of testosterone, female started secreting more of estrogen. So these hormonal changes starts as a particular age, and we called it as a puberty. So when initially, maybe 15, 20 years back, the age used to be around 12 to 13 for females and around 15 to 16 for the males. Nowadays, what is happening? A female getting early menarche called menstrual cycle. Like you can like see that 9, 10 years female start or teenagers start getting their first menstrual cycle. And even we have seen like in abroad 10 years girls getting pregnant, and these are the ways like puberty started little early, like the age 15, 16, now it's become 9, 10, and so on like that way. So the hormonal disturbance started early, and the testosterone secretion basically in males you feel that only males get bald. Females usually have a more of thinning in the hair. Females usually don't get bald completely. They usually get a thinning of hair that way. So when you consider a male losing hair early age, the main factor is puberty has started quite long back. Like at the age of 12 years, the puberty started, the hormone started rising, and that rising hormone level of testosterone leads to conversion of testosterone into a high DST hormone, which is responsible for a hair loss in the males. So when somebody is having a genetic predisposition, like somebody's father side, somebody is having baldness, or mother side having maternal uncle or grandfather is having baldness, the genes carries in you, and they start showing the results of a genetic baldness. So the genes doesn't act directly; it acts through a hormone called DST, and which has started secreting little early when you have an early onset of the puberty. So this is the way how these guys are started losing hair maybe at the age of 16, 17, and usually they get bald by the age of 20, 22. When the both genes, like mother side having a baldness and father side having baldness, both the genes comes to a play into some particular person, then early aging is also a problem there. So this is the basic factor which is causing a problem. So this is one of the major factors. But along with that, you can see associated factors also. It is not the only factor, but these factors are getting pushed by so many things. Like you can say, a first thing is the stress.
Yeah.
Like everybody is having a stress of competition. Like everybody wants to be on the top of the world. Every children wants to secure more than 90% mark in all the exams. Even their parents are very fussy about it. My kid should be on the top of it. So they are also pushing the kids for the this competitive race all the time. Medicines and what you say IIT and JEE. These are the things everybody wants to like crack at early age. Like you can see, I have never been to a tuition, but my son is at the age of 6 and 7. He is going for the coaching and all. So this is the way now the trend has changing, which is creating a premature stress on the kids. That is also one of the factors. Along with that, you can see about the screen time, like the habits what they are doing right now. Most of the kids are addicted to the YouTube and
Gadgets.
other platforms of social media, and they are not going out, not playing properly, sports and all that is lacking. Along with that, like other culture, you can talk about like junk foods and all that is also creating problem. So late night, like nobody is sleeping at a proper time, not nobody's getting around 6 or 7 o'clock in the morning, or used to be like when we used to say like Brahma Muhurta and all 4 o'clock, nobody's getting at now. Like most of the kids having a sleeping time around 2 or 3 o'clock in the midnight. So this is not the way how it should be, right? Along with that, no proper food. Basically, what we say like proper protein intake should be there, proper fruits and it should be taken, multiminerals, multivitamins. Along with that, it is very, very important to have an exercise also. Lot
Mm-hmm.
of females now, we can say 30% females are experiencing PCOS or PCOD, like polycystic
Yeah.
ovarian syndrome, not having a proper regular cycles, having excessive obesity.
So
Yeah,
the
you can
interesting
start next.
fact, if this is the hair loss. The story is that Kerala is known for pure coconut oil. People having very thick hairs, long hairs, especially if it's for girls. They'll be having very black thick hair, and now it has become the whole story has changed, and seems like everybody is going through the issues of early aging and everything. But again, talking about the hair transplant thing, what is the actual process that is happening here? What's the cost and how this is being done?
Okay, yeah, coming to the hair transplantation. Basically, I told you that hair transplantation is done for the bald people, not the
Mhm.
people who's just started losing the hair. Those people don't have any options like what we treat with the hair fall. So once you start with the hair fall, you should try to meet the doctor and try to control the hair fall with the medications, try to replace those deficiencies. And any PCOS, thyroid, and other issues are there, we will try
Mhm.
to deal with that as well.
Mhm.
So once we have tried with this and still your hair fall doesn't control and you keep on losing hair and one day you become bald, that time hair transplantation come into the picture. So hair transplantation is a process where we take out the graft of your own. Like suppose somebody is bald from the front area, you are going to take out the graft from the back side and you are going to implant on the area where there are no hair follicles. So this process is done under a local anesthesia. So only the skin part of the your scalp is getting anesthetized. You are not going to completely anesthetize the body. Only the skin portion is getting anesthetized. That means you are completely awake during the surgery, but there won't be any pain during the surgery. So one by one, you take out the graft from the back side. It is called as follicular unit extraction technique. There used to be an old technique where you are going to extract a graft along with the skin. So there used to be a stitches. Two portions has to be attached with the stitches, and you are going to just take out the complete skin along with the hair follicles, and then has to cut under the microscope, and one hair you have to implant. So this was the old technique called follicular unit transplantation technique, where you used to like do stitches and all these things. Now follicular unit extraction technique, you are not going to use any blade, you are not going to have any stitches, there is no scar as such, linear scar as such, but the process is more simple and more fine nowadays. So on the same day patient is getting discharged, and usually patient need around 7 to 9 months for the optimum results it is required. So it is completely a safe surgery when done in a proper center with the proper qualification of the doctor. You can definitely have a very good results. This is nowadays is almost 100% sure that you are going to get the results, unless and until you have some other comorbidity like diabetes, thyroid, and other problems. Then you can ask for a little better, you can say, optimization of the condition and then do a surgery. Then you will get a good result. So this is the process how we do it, and yeah, definitely a risk-free surgery. 100% safe surgery is mandatory, and being not very, you can say, aggressive or very high risk surgery, complication rate is very, very less in this case. And what you asked about the cost of the hair transplantation, right? So when you consider cost is all depend on the what is the area you're going to cover. Like suppose if it is less area, less number of graft, then the price will be little less. When it is more area you want to cover and you want to use scalp hair as well as beard hair, sometimes the chest hair for the implantation, the cost rises. Like you can ask like that way, start from 50,000, may go up to 3 lakh rupees depending on the doctor qualification as well as the technique of doing it. So it varies between patient to patient and doctor to doctor and center to center, like that way. But if you go to a standard doctor, like with a good qualification and good infrastructure, then its minimum cost starts from 50,000 rupees, what I can say.
Along with the hair transplantations, there are many hair treatments that these youngsters are into, like PRP treatment, likewise. So, what are the other hair treatments that are so common these days? And do these other treatments have any side effects as well?
Okay, yeah. Coming to hair fall treatment, basically we categorize into two parts. Basically, one is anti-hair fall treatment, where you are started losing the hair, your thickness becoming lesser and lesser day by day, your density started losing. That part is different. Like that is we can say a anti-hair loss treatment, or a treatment which controls your hair fall and improves your quality of hair follicles.
Correct.
So this is the treatment, but this treatment will not give a hair on a bald patch because there are no hair roots present on a bald patches. So this treatment will not work on a bald patches. This will work only when you have a hair follicle present, right? So first come to a medicinal part of it. Medicines means you are treating the underlying cause. Suppose somebody is having hemoglobin deficiency, you are treating with that. Somebody is having a ferritin deficiency, like iron is less, you are treating with that. Thyroid hormones problems, PCOS problems, and other nutritional deficiencies, vitamin D, B12, or any multi minerals like zinc, selenium. So you are going to treat that with the required supplement. Somebody is having a protein deficiency, we are treating with that. That is a one nutritional part you can say you address with one thing, because nowadays most of the people are not having good quality of food. So that we have to address with one thing. Second thing is a minoxidil is a drug, a choice of drug when you start losing too much of the hair. Then we start the patient on the minoxidil, which improves your hair circulation. Like you can say, blood circulation improves with the minoxidil, as well as your DHT level somehow it decreases with the minoxidil. Third drug is a finasteride, which is a DHT blocker. It's basically a drug of choice in the cases of androgenetic alopecia. Like whatever the genetic history you have, that causes increase in the DHT hormone level, and this finasteride helps you to reduce the DHT level. So these are basically drugs what we start with the patient of hair fall in the males most of the time. Along with that, associated treatments are, as you said, PRP is there. That's called platelet-rich plasma therapy, and that is with your own. Coming to the injection treatments, basically, the next treatment is a PRP, platelet-rich plasma therapy, where we draw blood from the patient's, like we draw blood from patient, then we centrifuge it and make a called platelet-rich plasma. Platelets and plasma is a combination where platelets helps to start secreting the growth factor and healing factor. So that is very, very important component of your blood, which helps in the healing part. So whatever the hair follicles get damaged during the process of miniaturization or thinning, this started reversing with the platelet-rich plasma therapy. So this is the one very, very important treatment everybody is looking for, and it helps to improve the quality of hair follicles. Whatever the stress, whatever the damage you have during last few years, it will help you to control that. That is the first treatment called PRP. Along with that, there are some advanced treatment along with the PRP. It's the advanced version of the PRP, you can say. There is one called biotin PRP, growth factor concentrate. These are the treatment where you get ready-made growth factors and healing factors like that. So these are the additional treatment. Along with that, you get some treatment which having a natural stem cells and natural growth factors in it. It's called growth factor or mesotherapy cocktails. Along with that, you get a latest one is called QR678 Neo, which is giving a very good results in a patient where you don't have to draw blood. Like you can directly start injecting into the patient's hair follicles, and it will help you to improve the hair quality as well as control the hair fall. So these are the newer treatments. Apart from that, you have some low-level laser therapy treatments, laser caps. You can start with it, and some people might suggest you a microneedling as well as like derma roller and some stamping method of microneedling, where it helps to improve the blood circulation in the particular area. So these are the newer treatment where we can start with the patient of hair fall, which might help in the patients with androgenetic alopecia along with the other causes of hair fall.
Right. So, like hair transplantation, I believe it's not for all. So maybe because of the health issues or even for the financial reasons, as you said. So for them, what will be some advice or suggestions that you will give?
So like there are two criteria where we don't consider hair transplantation as the first choice. First criteria is your age is very less and your level of baldness is very less. Like suppose nowadays 20 years guy want to have a small correction in the hairline also. Like he wants to lower the hairline. So this is not the only procedure where you should think about a cosmetic also. Because whatever the donor you have, it's a limited donor area, and in the future, if you lose more hair, you should have the donor area for the future. So don't consider this is a pure cosmetic treatment, because this is reserved for the baldness. Whatever the baldness you are going to get in the future, that need to be get addressed with the donor area, that with the hair transplantation. So don't go for a styling. Like if you want to go for a styling, go for a hair transplant. This should not be the scenario. This is one thing. Second thing, those having a too much of baldness, like a grade 7 baldness we call, like hair is from the top gone to the back side, where the donor is not sufficient. Like we cannot cover complete area with the hair transplantation. Like maybe only 3 fingers of transplantation is possible, and rest of the area become bald. That time it's not possible to do a complete coverage with the transplanted hair. That time we suggest not to go for it. And some skin condition like psoriasis is there, some other conditions along with some cancer is there. So this condition where the transplantation is going to damage the existing skin also and not going to be successful, like some patient of alopecia areata, where
Mm-hmm.
patient is having an autoimmune disorder and the transplanted hair may not survive in the future. So in such a cases, we try to avoid a transplantation. And
Okay.
in such a cases, we suggest usually to go for like artificial hair patches and might be a scalp micropigmentation in some cases. So this is the criteria where we don't ask patient to go for a hair transplant.
Anyway, that's it, Doctor. Thank you so much. It was a very insightful session with you, because I think this is a very needed talk, because many of them, even people of
Yes.
my friends whom I know also, are very concerned about the hair thing. Unlike the our parent generation, they are very much concerned about your hair falling. This is happening. So much of hair falling day after day. I don't know what to do. Even the oil I'm using, the customized shampoo or conditioners I'm using is not worth it. So people are very much concerned about it. So I think it should. This is a matter of the moment, and this can give a solution to all this. Hopefully, thank you. Anyway, thank you for joining with us.
Thank you very much. Yeah.